Be with you again this evening. Anxiety is inflicting the world as well as its complications and problems. And there are synonyms of anxiety: worry, concern, apprehensiveness, uneasiness, fearfulness, disquietude, angst, misgivings, tension, irritability, and sometimes, I don't know, these are more American expressions saying that you have the heebie-jeebies or butterflies in one's stomach or jitteriness. But essentially, it's no peace of mind. Last time I did a Google search on fear, it gave up 2.3 billion results in 1 second. And so you can see how fear itself is very much something that is researched and is talked about. The Merriam-Webster dictionary calls fear dread, fright, alarm, panic, terror, painful agitation in the presence or anticipation of danger. Fear is the most general term and implies anxiety and usually loss of courage. And that's one thing that is present in virtually all anxiety disorders is fear. Excessive worry. Fear can be a great motivator, however, but with anxiety disorders it tends to paralyze. And as one author stated, fear is the tax that conscience pays to guilt. And so if you are guilty of things that you've done wrong, then fear tends to come along with it because you know the day of reckoning is coming. So sometimes feeling anxious can be normal. People often experience a general state of worry or fear before confronting something challenging, such as a test, an examination, a recital, or an interview. But anxiety becomes problematic or a disorder when the feeling of fear is out of proportion to the nature of the threat. And that can interfere with good decision making or function. We've had people in our university that have test anxiety. They know their material well, but because their fear is out of proportion, they end up not being able to think well. Their frontal lobe doesn't work well on the test, and they end up doing a lot worse. And of course, that would be abnormal. That's an anxiety disorder when it comes that way. In the US, this was prior to COVID, 40 million adults suffered and already had been diagnosed with an anxiety disorder, or 18.1% of the population. And that was pre-COVID, and as you know, COVID has made it even worse. Undoubtedly higher since the pandemic. Anxiety disorders are now the most common category of mental illnesses worldwide. That's if we add up all the anxiety disorders compared to all the depressive disorders. Now, if we take a look at one major mental illness and break it all down, major depression, they will tell you, is number one, which is true. But anxiety disorders, if we add them all up, are actually surpassing that. And of course, that's a general category of anxiety disorders. We'll break it down for you here in a little bit. One of them is generalized anxiety disorders. This is excessive worry about a variety of topics, events, and activities. And this can be challenging to control. People will shift topics in their mind over what their anxiety is about. There are 3 out of 6 symptoms you have to have for this. In addition to fear, excessive worry or fear is present in generalized anxiety disorder and has to be present. But then the 3 out of 6 are feeling on edge or restless, fatigue, impaired focus, irritability, muscle aches or soreness, so even chronic pain can be due to anxiety, and difficulty sleeping. So you don't have to have all of those, just 3 out of 6, and you're an adult, and if you have excessive fear or worry, you have a generalized anxiety disorder. Now in children, generalized anxiety disorder just require the excessive fear in 1 out of those 6. So it's a little different in regards to diagnosing children. Panic disorder is one of the anxiety disorders and is very common. If you work in a hospital in the emergency room, every day you will see people come in thinking they're having a heart attack or thinking they're having a physical problem, and it's actually just a panic episode. And you have to have 4 out of 13 of these symptoms in order to be diagnosed with panic. Palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, shortness of breath or smothering sensation, a feeling of choking, chest pain or pressure, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint. And you can even have depersonalization or derealization. This is where you feel that you're unattached from reality or detached from oneself. Fear of losing control or going crazy. Fear of dying. Numbness or tingling sensations or paresthesias. Chills or hot flushes. So if you add all of these up, those are 13 symptoms of panic, but you only have to have 4. If you're having 4 of those at the same time, then that's a panic episode until proven otherwise. And of course, you can have a heart attack and have some of those symptoms as well, and that's why they think they're having a heart attack, because they're short of breath, they're having palpitations, they're having chest pain, they have fear of dying, and they come to the emergency room, and the EKG is normal, and the blood tests are all normal, and the doctor is now trying to put them on anti-anxiety drugs. Often in the emergency room, they'll be given a very highly addictive drug called a benzodiazepine. And it'll fill the GABA receptors, and the patient will start to relax and feel better and think that I just have a benzodiazepine deficiency. I just need to get on that drug. Watch out. They get on that drug, and yes, it'll make them feel better short term, but unless you treat and find out what the underlying cause of that panic disorder is, they will have just as bad of anxiety within a few weeks of being on the drug, and now they're addicted to the drug, and if you try to get them off it, their anxiety will worsen tenfold over what it was to begin with. And so this is why it's very important to be able to find the underlying cause and treat that underlying cause. Another common anxiety disorder is agoraphobia. Now, any phobia of course is the Greek word for fear, any phobia is actually an anxiety disorder, and there's a whole host of different phobias. One of the common ones is agoraphobia, and this is fear of excessive worry when outside your home. It can be in crowds, in the public, in open spaces, and it has to have occurred at least twice before someone is diagnosed with agoraphobia. And of course, there are a number of other phobias as well. There's the fear of flying. We've had individuals drive all the way from New York City to California because they don't want to fly. Fear of flying. We have people in California that have come to our program that have a fear of going over bridges. And that's not a good state to live in if you have a fear of going over bridges, because there's bridges everywhere with rivers and bays and all of that. But they'll go 2 hours out of their way to not go over a bridge to go to work because of that fear of going over bridges. And then there's fear of even decision making called decidophobia. And for these people with phobias, we can smile about it, but for them, it's no laughing matter. It is a serious issue and one that is quite paralyzing. Then we have post-traumatic stress disorder, which is also an anxiety disorder. You have a re-experiencing symptom where something will trigger you and you will have a flashback as if you are reliving the trauma. And it can include physical symptoms such as racing heart or sweating or bad dreams or frightening thoughts. It was first described in war, people who had experienced war and the trauma of war. This is why you see the soldier uniform there. But of course, you don't have to have a military background in order to have PTSD. So you have at least one re-experiencing symptom and at least one avoidance symptom. And that means that you stay away from places, events, or objects that are reminders of the traumatic experience. You avoid thoughts or feelings related to the traumatic event. And of course, this can be partly paralyzing as well. And at least two arousal and reactive symptoms, being easily startled or feeling tense or on edge or having difficulty sleeping or having angry outbursts. You don't need to have all of those, just two arousal symptoms, and at least two cognition and mood-related symptoms as well. And PTSD is something that when we experience traumatic events, there's some things that we can do to prevent that from happening. We'll be talking about that in a few nights in regards to what happens when you have an emotionally traumatic event come into your life. And then we'll also talk about particularly how to heal from it. There's 5 tasks that are very important to go through in the correct order to heal from PTSD. Obsessive compulsive disorder is also an anxiety disorder, and you can start to see when we add all these up why anxiety disorders afflict over 1/5 of the population now. But the person has obsessions where they're just rethinking certain things over and over again, compulsions, or both. Compulsions is the behavioral aspect, and of course the classic aspect of obsessive compulsive disorder are those that have germophobia, where they are washing their hands excessively with everything that they do, and they are fearful of touching things, fearful of being around people in public where they might get sick, and so that's behavioral changes that take place. But there's many other things that can be that you can be obsessing about or compulsive about. The obsessions or compulsions take up a lot of time. In order to be diagnosed with OCD, they have to be taking up at least an hour of your day every day due to these obsessions and compulsions. And we've had people come to our program where it's taking hours a day. We have had individuals come where they're just totally scalded from their hands all the way up to their arms. They'll look like a very old person, but they'll be a young person just because of this excessive hand washing. And we've had individuals, there was one lady who came to our program whose husband was a farmer, and he'd be out in the field and he'd be out, accumulating dirt on his boots, and he'd come home at night and she would have to wash the house all over again, spending hours trying to clean up after her husband. She had small children, and finally he got to the point where he thought it would just be better for his wife and kids if he moved out, because it was so traumatic for her. And once he moved out, she realized, wow, I'm spending all this time cleaning and all this, and I don't even have a husband coming home anymore because he's worried that I'm going to have to even clean more. And she realized the problem wasn't him with his dirty boots. The problem was her with the OCD, And so she ended up coming to the program, and her hands and arms were all scalded from all of this excessive cleaning of herself and others. Now, it is important to avoid germs. It's not that these things shouldn't be avoided. It's just that obsessive compulsive disorder people major in minors and minor in majors. And so this becomes an all-encompassing thing for them, where they're now neglecting more important things in their life due to the focus in on lesser important things. And so their priorities are significantly altered. And she finally started to get it when she realized she was losing her marriage and losing her life partner, and maybe it might be better to allow an occasional germ to come in than to, have a separation and divorce and have kids not being raised by a loving father because of this issue. So the obsessions or compulsions cause distress or affect participation in social activities, work responsibilities, or other life events. By the way, a lot of times people think these disorders, you're going to have to struggle with them for life. Not true. That girl in 10 days had her OCD, the solution for her OCD solved. And she was able to go home to her husband. She did spend 10 days with us in a residential program, but we found some genetic challenges that were setting her up. Often with OCD, there are some genetic things. There are also some other things in her upbringing that tended to bring this about. And then there were several other biochemical things and then thought patterns that we were able to help her with, and what a difference it can make. Social anxiety disorder is one of the most common as well, and sometimes this is synonymous. It is synonymous with social phobias, and we're seeing this in a far greater, as we discussed last night, far greater amounts than we used to see this, and this has its relationship with social media. Social media has made us antisocial. And there's a lot of young people that just can't handle the stress of face-to-face social interaction. And they've been used to other means of communication where it doesn't involve the full gamut of presenting yourself in public and having that dialogue. Most of us that are older, we grew up in an environment where that was a necessity, and we learned to appreciate and enjoy that environment. And of course, there are some significant advantages, as we talked about yesterday, to face-to-face social interaction. In fact, the biggest punishment you can give a prisoner is what? Solitary confinement. And so, but a lot of people are punishing themselves with this solitary confinement, but they don't think they're solitarily confined because they're still on a screen. But they actually are. As far as the studies are concerned, if you're just relating to people by screens, you are actually causing yourself self-torture in regards to not being out there in the full social aspect. We are social beings. We were designed to be social beings. And when we get isolated, it's not healthy for us. So with social anxiety disorder, everyday interactions cause significant anxiety, self-consciousness, and embarrassment, because you fear being what? Scrutinized or judged negatively by others. Have you heard those terms before in regards to those who are talking about others judging them negatively? Often it's not that others are judging them negatively, it's their own social anxiety that is causing them to think this particular way. And of course, it leads to avoidance that will disrupt your life. Physical symptoms also tend to come about more easily, such as blushing or feeling your mind has gone blank. You'll be out there in a social situation, and all of a sudden, because of that anxiety, your mind has gone blank. And then you can also notice it in individuals. They'll avoid eye contact, not wanting to meet unfamiliar people or strangers. And we're seeing on college campuses. I myself of course, are working on a college campus on a daily basis. And we've had many individuals come to our college campus to get rid of their social anxiety as college students at other universities. And these people will tell me that they'll go get the food in the cafeteria and they don't sit down to eat in the cafeteria. They go right back to their room and they eat that food in isolation. If they are out there, they're going to, when they might have to actually go to a class, they're going to avoid eye contact. They're not going to want to meet with unfamiliar people or strangers because of this fear of being scrutinized or judged negatively by others. Catastrophizing is also common in anxiety, certain types of anxiety disorders. This is where you think of the worst thing that can happen and think it actually will happen. And we've had individuals come to our program where the husband takes a week off for a family vacation, and they're packing, getting all ready to go, plan to go, and the husband says, "Sorry, family, we're not going. I just have a sense that we're going to have a huge accident, and someone's going to die if we go on this vacation. And so we've got to stay home." Of course, you can imagine how that negatively, adversely affects the family, particularly when it's repeated and now in different settings in regards to catastrophizing. And as one person that came to our program said it this way, and I put the quote up there, "The figments of my imagination are out to get me." And indeed, they were out to get him. And others have said, "I am worrying myself sick." And then there's something called magical worry. Maybe we'll get into that in a minute. If we don't, I'll talk about it. But eating disorders is actually also an anxiety disorder. Bulimics, which are those who will purge, they'll eat, and particularly eat to try to enjoy the food. Often it's very unhealthy food that they're eating. And then they don't want to suffer the consequences of that in regards to the waistline and their appearance and other health things, and so they will go in private and vomit all of that food up, and it can become an addiction. And bulimics have been shown to have a much higher social appearance anxiety than normal, and it's often associated with excessive worry about appearance, size, shape, and weight. And that is what can lead to the anorexia or bulimia. Anorexia, on top of it, is also a disorder of assumption. So you have an anxiety disorder combined with a disorder of assumption. Now, disorders of assumption are well documented in the Diagnostic Statistical Manual of Volume 5, but the reason why it's called a disorder of assumption is the person is identifying a certain way that is actually not true. So in other words, they'll look at themselves in the mirror even though they're dangerously thin, and they will see themselves as what? They'll see themselves as fat. Now, the solution to that, in pop psychology today, the pop psychologist will say the solution to that is let them identify as being fat and let them know that indeed they are fat if they're identifying themselves that way. What would that do to a person with anorexia? It could actually kill them. It could actually kill them. So you don't want to affirm them in their false ways of identifying. You actually want to help them with compassion and care to see themselves as they really are. And so we have a lot of disorders of assumption out there. I was at another place today speaking in another portion of Sydney where the individuals started talking to me about a school. Maybe you guys have heard of this. I would think it may have gotten on the news. Maybe it didn't. I know we have individuals identifying as cats. We've had one actually come to our program. Teenage girl who had the cat suit, identifying as a cat. but there's a school system here where they were told that you just have to go along with this identification. And so this girl actually had a kitty litter over in the corner, and she would actually urinate and defecate in this kitty litter, in public like a cat would do, in order to accommodate her mental illness and try to help her through that mental illness. That is not the correct way of dealing with the situation at all, and inflicting that on a lot of others. And so those are disorders of assumption, and they have to be treated as disorders of assumption. So we have a high rate today of lots of different disorders of assumption. These things, of course, are causing a lot of mental health issues. So when people, one of the clues that you may be excessively worrying is when most things you are worrying about actually don't happen. And some people, I guess I don't think I have a slide on it, that have this happen, where the most things they're worrying about don't happen, actually have what's called magical worry. Magical worry is the belief that you must worry about it, otherwise it will happen. And so, of course, they will end up worrying themselves sick. Or there it is, magical worry. And then, am I worrying? The question can be, am I worrying to distract myself from something that is deeper that I don't want to reflect on? Often that can be the case, and so you are allowing yourself, actually forcing yourself to ruminate about something worrying because you don't want to actually think about something deeper to reflect on. Well, anxiety would be bad enough if it just caused those symptoms, but there's lots of complications of anxiety. Insomnia is one of those. Depression, often we'll have people with severe major depression, but they will tell us that it actually started out with anxiety, and that excessive anxiety then went into severe depression. Substance misuse. Often individuals will start to self-medicate with alcohol, with marijuana, with pornography. Self-harm can also come about. The anxiety feelings can be so significant that the individual will actually cut themselves with a knife, and they will often tell me that the reason why they do that is the emotional pain was so severe that they wanted to get their mind off of it. And so they produce severe physical pain in themselves, watch the blood run, and that distracted their mind from their emotional pain. And it also sets themselves up for an addiction. And so often those who are self-harming, it's not that they're wanting to commit suicide. Suicide's not part of it. It's actually part of the complication of not taking care of the underlying symptoms of anxiety and trying to find false ways to self-medicate. And so self-harm is one of those self-medicating ways. Digestive or bowel problems can be very common in anxiety disorders. We had a gentleman, one of my specialties is gastroenterology. Prior to my going into mental health issues 20 years ago, there was a kind of a transition period. I was doing gastroenterology almost full-time, and so I would be doing all sorts of scopes, all sorts of procedures on people, et cetera. One of the reasons why I got involved in this, in fact, this is kind of confession time as a doctor, there was a patient and that came to me with severe abdominal pain and had seen a lot of different gastroenterologists and had had CAT scans, MRIs, blood tests, upper and lower endoscopy, capsule endoscopy. And I'm looking at this whole big encyclopedia of tests that were run and treatments that were done. And I saw one medicine that hadn't been used. And I was scratching my head. I was a younger GI doctor at the time. I was scratching my head, what could be causing all this? And I thought, have all the treatments been tried? And she had been tried on all these proton pump inhibitors, but had not been tried on an H2 blocker by the name of famotidine. You might be familiar with that for those in the medical profession over here, but it comes by a name called Pepcid in the United States. And this was back before computerized records and typing things in, so we always had to write things down and write a prescription. So I wrote Pepcid, 20 milligrams, BID. Gave it to the patient, said, I don't see that this type of drug has been utilized. I'm just wanting to see if this might help. She comes back, and I said, see me in a month. She comes back a month later, and she's got a big smile on her face. And she says, can I give you a hug? She says, you solved my problem. My abdominal pain is gone. And I looked at the chart and I thought, I wasn't even sure this was going to work, but to work that well, it's pretty amazing. And so I said, can you show me that bottle? So she gave me the bottle, and it didn't say Pepcid, it said Paxil, 20 milligrams twice daily. Paxil is paroxetine, which is an SSRI drug that is used for anxiety and depression. And so what helped her abdominal pain was actually an anti-anxiety, antidepressant drug, and her abdominal pain went away. And of course, that's when I began to realize in a greater way, I already knew anxiety could affect the GI tract. But we started to see this more frequently. There was a gentleman that came all the way. He was a wealthy business person, CEO type of person in charge of several companies that heard about our specialty for the difficult to diagnose patient. And he had significant abdominal pain. When he'd eat, he'd get into this severe abdominal pain, and he was losing weight and having significant issues. He came with a similar encyclopedia of all these tests. And I did do a little question, you know, is there anything that makes it better? And he told us what makes it better. Is there anything that makes it worse? And after going through this entire encyclopedia, I said, sir, your problem is not your stomach. Your problem is not your GI tract. Your problem is anxiety. And he said, doctor, I know I have anxiety, but that's because I have all this abdominal pain. If you would take care of the abdominal pain, then I wouldn't have anxiety. And I said, no, sir, it's the other way around. And he says, how do you know that? And I said, because you told me the only thing that helps is taking a lorazepam drug. Lorazepam is a benzodiazepine. It's only working on the central nervous system, filling the GABA receptors to help the anxiety. And the fact that that's the only thing that makes it better, and now you've gotten hooked on lorazepam, and now it's not working so well, you actually need to come to our residential anxiety recovery program to get off the lorazepam and for us to solve what's causing the anxiety behind it. And he couldn't come right away because he was a busy CEO, but he scheduled it the next time to come about 2 months later. And he came, he got off his IV, it wasn't IV, it was PO lorazepam, although he had been seen in the ER and had been given IV lorazepam when he had severe abdominal pain. He got off his lorazepam by day 6, and by day 10, he was throwing away all of his pain medicines because his anxiety had been solved. And it wasn't another GI test that he needed. It wasn't SIBO or those sorts of things. So in fact, sometimes I have to tell the people in the GI world, if we were to scrape all of your nerves off of your gastrointestinal tract at the time of surgery and weight all of those nerves, they would weigh 4 times as much as the entire spinal cord. And so there's a huge plexus of nervous tissue supplying that gut. And this is why people often feel like it is their gut that's the problem, but it's actually up here, the anxiety. Headaches is also a complication of anxiety, even migraines. Chronic pain, as we mentioned, in a lot of different areas, can even be spinal pain, and then complications of social isolation, and then problems functioning as a result of the anxiety at school, work, and family. And then also, even more so than depression, anxiety suppresses the immune system. And as a result, we will see often overwhelming viral infections. And this is what was shown in the Centers of Disease Control studies that were accumulated. The strongest risk factor for COVID death during the COVID pandemic, you might have heard about it, was obesity. But number two, almost tied with obesity, and depending how you look at it, it may have been number one. Number two was anxiety. Anxiety suppresses the immune system. And those who were the most fearful of COVID, when they got COVID, had a much higher risk of dying just because of their fear of it. And of course, the news media drove that fear significantly even more. Politicians drove the fear, et cetera, and they were unwittingly making the situation worse by causing all of this excessive fear and anxiety. Diabetes was the third, and patients with multiple conditions was the fourth. So what's more difficult to treat, depression or anxiety? When you look at the psychological literature, they will tell you anxiety is more difficult. It requires higher doses of medicines. For instance, Paxil is used for depression. You can treat Paxil with 20 milligrams in depression often, but with anxiety, you're going to need 40 or more. And of course, that means more side effects, more problems. So less long-term response to medication, and by the way, medication for depression doesn't have a very good rate either. It's very limited in its effects, and it's not highly successful. But anxiety often requires double or triple the doses to treat depression with more side effects. So the real solution, just like it is with depression, is to look for the causes. And those causes can be in one of 10 categories. We talked a little bit about those 10 categories without mentioning all of them yesterday, but genetics can be a setup for this. If your parents have suffered or siblings with anxiety disorders, you're more likely to have it. And then also attachment issues in childhood can also drive this. Adverse childhood events, even lack of light, which I've told you during the COVID pandemic was even more prevalent, but with all of this indoor time on screens, it does increase the risk of anxiety. Lack of physical exercise. Physical exercise is one of the best treatments for anxiety. A sleep-wake cycle that is not regular. It's all over the map. Addictions can actually cause anxiety. People look for addictions to treat it, but those addictions end up even causing more problems. Nutritional causes can also be a major cause. Even sexual behaviors, we'll talk about this in a couple of nights, or maybe it's tomorrow night. I haven't looked at the schedule, but we're going to be talking about intimacy and emotional health. Adult traumas or tensions in relationships, and there can be spiritual causes as well. In fact, there's even a spiritual type of OCD called scrupulosity that the world does not know how to treat at all. And it can be very crippling, but there are spiritual solutions to that that are not that complex that the world doesn't understand. But then there's also other incongruent spirituality. It's amazing how people will believe certain beliefs that totally disagree with each other. And we have a purpose counselor who's also a spiritual counselor in our program, and he'll give them a worldview sheet and say, what do you believe? And they'll be checking all these different beliefs, And then he'll look at that and say, no wonder you're having issues. You are very inconsistent. You're either, this side would be very consistent if you have beliefs on this side, or if you have beliefs on the other side, that would be all very consistent, but this is inconsistent. And so what is it that you actually believe? And let's talk about what your firm beliefs are and have you aligned with something that is practical and useful and congruent for you. So speaking of genetics, for those who are more obsessive and controlling, they tend to have personalities with this type of genetics. They can have a calm exterior. People, when they first know them, think they have everything under control, but inside it's very tense. And this is characteristic of those that have a gene for undermethylation. And once we find that gene active, it can be helped by simple nutritional supplements like inositol, S-adenosylmethionine, or saffron, or a combination of all three can produce some markedly improved biochemistry, far better than pharmaceuticals can help. Then we can actually measure them 6 weeks later and find out they're methylating completely normally. And it has, the genetic part has been solved. SSRIs will tend to help these individuals in high doses, but attempting to tolerate the side effects can be an issue. And that's why it's far better to treat it naturally at where the defect level is. Undermethylation is also helped by light therapy. So just being exposed to a frequency of blue light similar to the blue sky at the same time every day at like 6 a.m., if you're going to be getting up at 6 a.m., can help this significantly. It can help you make more serotonin, which can help the anxiety, and it can also put you on a regular sleep-wake schedule where you'll be sleeping far better at night and having more energy in the daytime. We used to utilize a light box that people would sit in front of. You don't want to necessarily look at it directly, but it's offset where it works the best. Looking at it directly doesn't work so well because it's going through the cones of your eyes. You want it to be the rods, which is more your peripheral vision. But now we have a more convenient way of getting it through light glasses. So they'll actually put glasses on in the morning, they can walk around, do their work, and it's emitting this blue light, this soft blue light that will help them to be able to counteract this undermethylation gene. Cognitive behavioral therapy is also key in helping this. As we mentioned last night, when we're able to help people with stress control, they'll be able to make more serotonin from tryptophan. If they're not handling stress well, they have trouble making those neurotransmitters. Then some people with anxiety will actually be overmethylating. These are individuals that are more naturally empathetic than the undermethylators are. They tend to be more artistic, more creative, more musical, but they have high labile anxiety, meaning that they seem to be fine, and they even think they're themselves fine, but then there'll be a certain trigger that just totally sets them off. We call that labile anxiety. And they have a tendency to be hyperactive and have a number of sensitivities and have insomnia. If they're given an SSRI, they're going to get worse. They're going to feel even worse because they're an overmethylator. But these people tend to like the benzos, and they'll think that they have this lorazepam deficiency. Even low-dose lithium can help them. And, but supplements like folic acid or hydroxycobalamin can be helpful. Acetylcholine can be helpful. And we have a supplement that we put together called Focus, particularly for overmethylators, that helps them with even their distractibility element of things. Then you can have a genetic condition due to low copper carrying capacity in your bloodstream called ceruloplasmin. And this results in high free copper, which causes you to make too much of one neurotransmitter called norepinephrine, a cousin of adrenaline, and too low a dopamine level. Dopamine is what gives you the enjoyment of the usual activities in life. So if you're no longer enjoying the usual activities of life and feel like you have adrenaline on board that you don't want to have, this could be the metal metabolism disorder. And so they have a tendency for anxiety, worry, and panic, and decreased joy of life. They often have headaches and migraines with this. And women will tend to have the premenstrual dysphoric disorder. For those who've had postpartum depression or premenstrual dysphoria, it's often due to this metal metabolism disorder, which is actually pretty easily solved with supplements. They can have early morning awakening because of this adrenaline. And so we give these individuals zinc on an increasing basis, up to 100 or 200 milligrams of zinc picolinate a day, which is about 40 milligrams of elemental zinc. And then a couple of B vitamins, B6 and P5P, and biotin. And as we step this up, they'll be able to get their excess copper level down, and their norepinephrine level will come down, and their dopamine level will come up. Then there's another one called a pyrrole disorder, which is associated particularly with the irrational fears and the phobias. And these people will be sensitive to lights or sounds or textures. They'll have to cut the tags off their clothes. They'll easily startle with sounds, and they can have anger issues. And if they're not on a schedule, they'll tend to be a nighttime person and want to skip breakfast, and a tendency to be easily distracted. And they'll have a poor short-term memory, meaning that they tend not to retain what they're reading. And this is also helped by the same supplement that helps those with copper excess, which is zinc and B6, P5P, plus we'll add N-acetylcysteine, and we can take those pyrroles down to normal even though they have a genetic disorder. In regards to anxious attachment, and I'm just seeing I've gone a little bit over time. Anxious attachment is a disorder is caused by parents who are inconsistent in their response. Sometimes they neglect the child, and sometimes they're overly helicopter parents. This can be a sign that they have an alcoholic parent. Alcoholic parents will neglect their kids during their alcoholic binges, but then when they're sober, they can actually be too much. Or a technology addicted parent, which is very common today, which causes neglect of their children. And so the children believe that they cannot depend on their needs being met, and they never know what might happen next. And of course, that can lead to anxious attachment, and they can have personality traits of being controlling and erratic and unpredictable, although they can be very charming at times as well. So anxious attachment people desire emotional intimacy, but others are reluctant to get as close as I would like, they'll notice. They almost smother in regards to emotional intimacy, and they often worry that their friend or partner doesn't really love or care for them and won't stay with them, and they'll want to merge completely with another person, and this desire sometimes scares people away. And so the solution to this is, well, I won't go into more detail. Yeah, helping the anxiously attached be aware of the tendency to control and get too close, communicate desires effectively while giving freedom to the other individual, and consistently go to a secure base for comfort and connection, and develop an accurate picture of your own strengths and weaknesses. These are going to be very important in the counseling sessions for those who were driven to anxiety as a result of the way in which they were raised. And making that spiritual connection can also be important. So let me just go through. There's several different aspects I wanted to cover before we close this section. And one of them has to do with imagination. A runaway imagination is a major source of anxiety. In America, I know you don't have very tall mountains here, but in California, where I live, there's a number of ski resorts, probably about 20 ski resorts within an hour's drive of us in the Sierra Mountains. And so for those who live in our portion of California, we will talk to them in ways that they can understand, because there are a lot of people that grew up skiing in the area. And when you go up a ski hill on a lift, you will see a lot of bad places to go down the mountain. You're going to see cliffs. You're going to see boulders. You're going to see, rock slides. You're going to see trees. You're going to see a lot of things that could cause you problems going down that mountain. And when you get on the hill, do you think it's good to be looking at all those bad places to go down? No, you actually want to look where you're going to go and the safe place to go down. And a runaway imagination, if you're just thinking about all those bad places, you're going to be looking at them, and guess what's going to happen? Your skis are going to go that direction. And it's going to get worse. A skillful imagination is a potent stress reliever. And so as we stay focused on the things that are helpful, it can be a potent stress reliever. And one of the things that can also be a potent stress reliever is what the Apostle Paul told us to do: set your affections on things above, not on things of the earth. Average person has 80% of their thoughts negative and 95% repetitive, but studies show in order to have lasting change regarding severe anxiety disorders, that has to be flipped to where 3 out of 4 of your thoughts are positive and not negative. So once you go 75% the other way, what a difference it can make. But that requires a skillful imagination and not a runaway imagination. And so this is why the therapeutic aspect is indeed critically important. So I know we need to have time for a break and some water. I will allow you some time for that. If you have questions, I'm sure you have questions about this. We are going to answer questions after the next hour. So write your questions down. I know we weren't able to cover this topic comprehensively, but we gave you enough to be able to ask some questions and ask some clarifications if you would like. And we'll see you back in a few minutes for the next session. Thank you. Well, we're going to talk about nutrition in the brain. This is every neuron has to have a manufacturing plant for different neurotransmitters. And this is the manufacturing plant for dopamine and norepinephrine. You have to have L-tyrosine be taken up by the neuron, which turns into L-dopa, and then dopamine. Free copper will then drive it over to norepinephrine. And at too much free copper, you'll get too little dopamine and too much norepinephrine. And then when an electrical transmission occurs, that vesicle will releasing the norepinephrine out into the synapse. If it's picked up by a receptor, another electrical transmission will occur. And then it's vacuumed back up again through the reuptake channels to be reused, so we don't have to use another billion ATP molecules to produce yet another norepinephrine. Often this brain fog or fatigue is actually due to these pharmaceuticals, which block those reuptake channels and make the neuron even have the demands to produce more. So nutrition is possibly the most overlooked cause of diminished mental power, depression, or anxiety, and can have profound effects. Once a nutrition change is adopted, it normally takes 7 to 10 days to begin noticing a difference. Just like taking a pharmaceutical can take at least that. But gradual improvement will continue, with the maximum effect taking place about 6 months after a consistent change has been made. And so this is why we want to continue on a good diet. So there can be a number of issues that we look at in our screening in regards to lack of mental power or ability in regards to nutrition. Not enough tryptophan, not enough tyrosine, excessive cholesterol or oxidized cholesterol, Excessive arachidonic acid. Arachidonic acid is a pro-inflammatory mediator that, and depression and anxiety is often due to inflammation of the brain. This is why we measure all the inflammatory markers. And arachidonic acid is present in meat and fish and eggs. So one of the reasons why we're getting that out if inflammation is part of the issue. Insufficient dietary folate, sometimes called vitamin B9. Insufficient iron. Iron is involved in the making of 4 different neurotransmitters, including GABA-aminobutyric acid. Low omega-3 fatty acid intake. Omega-3 is an essential fat, and it's very healthy for our brain. Insufficient magnesium can also be a problem. Magnesium is very important for mental health in both depression and anxiety. Not enough zinc can also be a problem, or not enough of other B vitamins or other nutrients. So I don't know that we'll have time to go into all of those, but we'll be able to go into some of these tonight in this 40-minute or so session. So dietary tryptophan does not necessarily equal brain tryptophan. We talked about this last night, where if you have tryptophan but not with carbs or B vitamins, it's not going to get into the brain sufficiently. Tryptophan is necessary because it's an essential amino acid, and it's converted to serotonin in the daytime, melatonin at night, and it's also converted to niacin, which is vitamin B3. It's the least abundant amino acid in the diet, however, and the conversion of tryptophan to 5-HTP is inhibited by stress. So once again, you don't handle stress well, you're not going to make serotonin well. And of course, it's a vicious feedback. If you don't have enough serotonin, you're going to get more irritable with the usual nuisances of life. And so this is why it's not just brain biochemistry, it's also the cognitive behavioral therapy that is important. It's inhibited by stress. It's also inhibited by insulin resistance. What's another name for insulin resistance? Diabetes. So if you're a diabetic, the new term for that is diapression, because it not only affects your blood vessels and your kidneys and your nerves, but it also affects your brain, because if you have insulin resistance, you're not going to be able to get enough tryptophan across the blood-brain barrier unless you start fixing that insulin resistance. What is one of the ways of fixing that insulin resistance? Diet, getting sugar out of the diet, but even potentially more importantly, exercise. That's right. So exercise works like insulin in getting tryptophan across the blood-brain barrier. And so physical exercise is a key aspect in becoming physically fit to help that tryptophan get into the brain. It's also inhibited by magnesium deficiency, B6 deficiency, lack of light, and increasing age. But if you have all the other factors there, you can be an 80-year-old and still make plenty of serotonin, although you won't make as much as you were in your 30s. So tryptophan has been shown to improve your general mood. It decreases quarrelsome behaviors and increases agreeable behaviors. And so if you're having issues in your family or those closest to you, it may not be due to what you think it's due to. It actually may be due to the brain chemistry of the individuals who are living together that can't seem to get along. Tryptophan supplementation has also been shown to improve premenstrual dysphoria from ovulation to the 3rd day of menstruation. It improves seasonal affective disorder. It improves depression, insomnia, obstructive sleep apnea. Now, what's the most common treatment for sleep apnea? The CPAP mask, yeah. What also is a very effective treatment? It's actually weight loss. If you get down to your ideal weight, 80% of sleep apnea will go away. But a lot of people are not aware that getting enough tryptophan in the brain also helps significantly with sleep apnea. It also improves nicotine withdrawal. This is why in our program, I think someone asked this last night, do we deal with drug addicts in our program? And yes, every program we have people that are addicted to drugs. In fact, I don't think we've ever had a program, even though smoking has gone way down in the United States, nicotine usage is making a rise. It's making a rise through vaping and the e-cigarettes and things like this. And nicotine is one of those powerful addictions that has adverse effects on your brain. And so, and of course, we also deal with the opioid addictions, with the benzo addictions. Marijuana also is addictive. A lot of different substance addictions, meth, etc. And when people come to our program, they're often amazed at how easy it is to get over these addictions. And sometimes it's so easy for them in comparison to when they tried to get over it before coming to the program, that they have this false idea that I can pick it up again when I go back home because it's so easy to overcome, because I went to this program and it was so simple. No, we have to tell them, don't try this at home, because we're giving them the nutrition to help their serotonin levels and their tryptophan and all of that. So they're getting the nutrients that are going to help them with their withdrawal symptoms significantly. And so we kind of, I don't know how many of you have been to Africa, but I've been there several times, and Africa has, in some places, has this rainy season, and then most of the year it's the dry season. And you can get on these dirt roads, and there's ruts in these dry roads that are all dried out. And those ruts, in fact, there'll even be signs, choose your ruts carefully. You will be in them for miles, before you get out of them. But those ruts will stay there during the dry season, but when the wet season comes about, they can all change. And we tell them when they're going through their program, their brain has become the wet season. The brain is changing, and there are some very easy things that will be easy for them in the program. And that's why it's good to stay off that addiction when they go home, because the dry season might be coming up again. Autism also can be improved with tryptophan supplementation. And of course, cognitive function. Serotonin is used extensively in the frontal lobe and helps us with our analysis and our decision making. And it also helps with social affiliation, as we talked about. When you have enough serotonin, you're actually wanting to get out and socialize and have that healthy social relationship. And of course, it also helps with sleep because of its association with melatonin. So, which foods are the richest in tryptophan per 100 grams? This is one of the ways of looking at it. You can see the top 10 here. Oats are a good source. Tofu is a good source. Flaxseed is even higher. Black walnuts are higher. Sunflower seeds even higher yet. Sesame seeds are up there near the top. Chia seeds even higher, and the highest as far as tryptophan per 100 grams is pumpkin or squash seeds. The reason why it says roasted is because you have more tryptophan available when you roast it versus when you eat it raw. Now, eating it raw, you'll still get a fair amount. It's not that you're not getting any, but we just looked at the top sources there. But it's not just tryptophan, it's also getting enough carbs. And those foods all had carbs in them. There's 3 critical dietary factors that work together to improve mood and cognition. Tryptophan, carbohydrates, because it's an insulin-mediated mechanism to get tryptophan across the blood-brain barrier, and water-soluble vitamins and minerals that are also crucially important. Large neutral amino acids compete with tryptophan to cross the blood-brain barrier. Carbohydrates derived from whole foods tend to reduce the stress hormone cortisol, and carbohydrates also induce muscles to uptake the large neutral amino acids, thus improving tryptophan access to the brain. Carbohydrates increase brain tryptophan absorption and therefore increase serotonin. A low-carb, high-protein diet that has become very popularized actually reduces the amount of tryptophan in the brain, and it will have its consequences. This is a quote from a study in neuroscience. Tryptophan is transported into the brain by a transport system that is active toward all the large neutral amino acids, and tryptophan is the least abundant amino acid in protein. There's competition between various amino acids for the transport system, so after the ingestion of a meal containing protein, the rise in the plasma level of the other large neutral amino acids will prevent the rise in plasma tryptophan from increasing brain tryptophan. The idea common in popular culture that a high-protein food such as turkey will raise brain tryptophan and serotonin is unfortunately what? Unfortunately false. If someone could get me a little water, that'd be great. So it's not because turkey doesn't have tryptophan. It doesn't have the carbs, and it doesn't have those B vitamins and the other things that can help us get tryptophan across the blood-brain barrier. And so it'll go into your muscles, but it won't go into your brain. So let's take a look at the foods that have the best ratios. You can see beef has some tryptophan, but it's very low in tryptophan, only 2.6%. The other 90+%, thank you, is the other 90-some% is the large neutral amino acids. Tofu, 4%, 96% the other large neutral amino acids. But then as you get towards the top, you see some significant marked improvement in the tryptophan to the other amino acids. So you see flax seeds, quinoa is up there. By the way, pumpkin seeds, which are a good source, are 5%. Anything above 5 is great. Quinoa is even higher yet. Flax seeds higher yet. Cauliflower higher yet. Sweet potato higher yet. And grapes are either red or green or high, and chia seeds is actually the highest. And this is why in our program we're emphasizing a lot of those different seeds: flaxseed, pumpkin seeds, chia seeds, etc. So, and that combined with exercise and the light can produce some significant benefit. So tyrosine supplementation in response to stress. Let's take a look at this amino acid that also can be a challenge. Those given tyrosine have significantly reduced headaches, stress, fatigue, and muscle aches and sleepiness compared to controls. Improvements are noted in mood and mental states. So happiness goes up, their mental clarity goes up, hostility goes down, tension goes down, and their cognitive tests improve. Even their math skills get better, coding map compass, pattern recognition in the tyrosine group. Tyrosine also increased feelings of vigor and improvement in blood pressure. So, of course, tyrosine turns into two different neurotransmitters. What are the two neurotransmitters that tyrosine turns into? I think I mentioned it earlier, but I might have mentioned it quickly, and you might not have caught it. Anyone? Yes, norepinephrine and dopamine. So I did mention it earlier on. Not a lot of you were here when I mentioned that slide, so I'll give you a break on not knowing that. But tyrosine Mustard greens are a good source of tyrosine. Lamb's quarters, that is not the hind leg of a small sheep. That's actually a weed, a green. Tomatoes, lima beans, tofu, even better than tofu as far as tyrosine is edamame, the green soybeans. Almonds, oats are up there in the top 5. Sunflower seeds, wheat germ. Notice wheat germ is a good source of tyrosine. A lot of people think all wheat is bad. It's not bad. If you're sensitive to gluten, which only 4% of the population is at most, then you can get your tyrosine from other sources. But gluten actually does help us, helps the rest of us in a number of ways. And one of those ways is making enough dopamine and norepinephrine. Peanuts even higher than wheat, and pumpkin seeds, fortunately, are the #1 source of tyrosine as well. Tyrosine has 3 different competing amino acids that compete with it, and these are the top 10 in the ratio. I probably shouldn't mention beef because you need carbs. Beef is, again, going to be a low carb or no carb food. You want to have carbs with the tyrosine to get it across. But you can see sweet potato, flaxseed, chia seed, and even improving above that, tofu, pumpkin seeds. But there are 3 foods above pumpkin seeds, and that is soybeans, watermelon, and mustard greens. Watermelon can actually help you once you're caffeine free. In fact, we had a patient that came to our program with significant anxiety. He was a trucker, and he was worried because we had taken him off of caffeine. Caffeine and anxiety do not go well together, and it's going to fuel the anxiety. So he was caffeine free, and he was doing well at the end of the program. And he said, you know, my anxiety is doing a lot better. I'm going to try to stay on this, but he says, I'm worried, Dr. Nedley, because sometimes I get a call at 4 o'clock in the afternoon from my boss saying that I need to deliver this big part over to New Mexico and drive all night to get it there in the morning because they have 100 men drilling a well, and that part broke, and they're going to have to pay those 100 men for doing nothing the next day, or they need to get that part to them so they can all work. And so he's the one selected to drive that all night, and he said, I'm going to have my caffeine. I said, actually, you won't. Once you're caffeine free for 2 weeks, I'll give you a choice, watermelon or mustard greens. What do you think he chose? He chose watermelon, and he says it works like a charm. He has it right there in his truck, keeps it refrigerated, and he says, I like it a lot better than caffeine because caffeine gave me a wired feeling. It kept me awake, but I just felt wired and anxious. Where watermelon, I don't have that anxiety at all, but I'm very alert and unable to stay up the whole night. But that's just a warning. If you are caffeine free, you don't want to eat your watermelon at night. You want to have that watermelon in the morning. It can be quite stimulating. The ironic conclusion: don't chow down on high protein sources to boost either tyrosine or tryptophan. Lower protein diets actually lead to more amino acids in the brain as long as they're sufficient because you have less competitors. And then emphasize the carbohydrate-rich plant sources of nutrition. Dietary vitamin C is also very important. Vitamin C from fruit and vegetable sources is associated with less depressive symptoms in the general population. And adequate intake of vitamin C has been found to improve attention, work productivity, work engagement, and vitality. And so getting those vitamin C foods, particularly at breakfast in the morning, is important. And that bridges over to the power of whole plant foods. Eating plant foods in their whole form provide great nutritional benefits, and the plant foods exceed that of their component parts. For instance, 1 cup of kale has 50 milligrams of vitamin C and 13 units of vitamin E. That's a great food, kale. But the antioxidant potential of that 1 cup of kale is equal to 800 milligrams of vitamin C and 1,100 units of vitamin E. What does that mean? That means when people come to the program, we don't feed them vitamin A, C, and E supplements. Those are the 3 antioxidant vitamins. We give them the whole plant foods because it's going to exceed that of the component parts of us giving them vitamins in a pill. So antioxidants have been shown to reduce the breakdown of neurotransmitters. That's one of the reasons why they work. They increase serotonin and dopamine concentrations in the brain. Isoflavone antioxidants are especially good for the mental health of women in menopause. That isoflavone is present in soy. And antioxidant trials produced improved depression and anxiety scores and quality of life in 6 weeks after taking them. So the top 10 antioxidant vegetables have been graphed by the Human Nutrition Laboratory in Baltimore, Maryland. Number 10 is eggplant. Eggplant is in there among the top. Corn is number 9. Number 8, onions. Number 7, red bell peppers. Number 6, beets. Beets are loaded with antioxidants, quite healthy. Number 5, broccoli, even better than beets. And number 4, Brussels sprouts, loaded with antioxidants. And then number 3 are the greens. We've mentioned this one already. Spinach, excellent antioxidant vegetable. Higher than spinach, as you might guess, was the one I just talked about, kale. And does anyone know what the top antioxidant vegetable is? Number 1 is garlic. That's right. And that was the advantage of myself being an American marrying a Romanian woman, because every Romanian entree starts out with 4 cloves of garlic. So the top 10 antioxidant fruits. Number 10, grapefruit. Number 9, kiwi. Number 8, cherries. Number 7, red grapes. Number 6, oranges even beat red grapes. Number 5, it's a humble fruit, but loaded with antioxidants, plums. And the top antioxidant fruits are all in the berry family. Raspberries are number 4, strawberries number 3, blackberries are number 2, and number 1, indeed, are blueberries. Do they grow blueberries in Australia? Okay, very good. Zinc is effective as an antidepressant alone or in combination to SSRI and TCA medications. Those are tricyclic antidepressants. In fact, the newer pharmaceuticals are actually putting the pharmaceutical with zinc because they get a far better effect. And of course, people think it's the pharmaceutical that's producing the effect. But the zinc might even be more important, because 2 weeks of zinc supplementation increases the receptors for serotonin. So the serotonin has more to bind onto, both the HT1 and the HT2 receptors, and it can also improve attention deficit hyperactivity disorders. Now, the foods highest in zinc, these are some of your top ones: sunflower seeds, pecans, sesame seed, cashews, pine nuts, wild rice is a good source of zinc, and pumpkin seeds are up there again. As you might guess, we have pumpkin seeds at every meal at our depression and anxiety recovery program. We put it on cereal at breakfast, we put it on the salads at lunch, and it can make a difference. Magnesium also is critically important. It increases brain serotonin levels, can improve depression and anxiety in 2 weeks, 500 milligrams 4 times daily, or 248 milligrams of elemental magnesium per day was all that was needed to improve depression and anxiety in 2 weeks. And it also helps you methylate, producing that final step in producing neurotransmitters, including the GABA-aminobutyric acid one, which is a neuroinhibitory neurotransmitter that helps you feel calm under stress. This is why some of the supplements that say calm in them are actually utilizing magnesium. These are foods that are higher in magnesium. You can see spinach comes out on top in the magnesium, as well as Swiss chard, another green. And the beans can also be a good source of it. And whole grains can also have magnesium, as does soy. Then omega-3 is also beneficial. Omega-3 fatty acids are involved in brain development, function, and aging. Dietary deficiency is associated with a higher risk of depression, bipolar disorder, schizophrenia, dementia, ADHD, and autism. And so this is a crucial, essential nutrient that a lot of Americans are short in. The problem is it must be acquired through diet. And actually fish also have to acquire it through their diet. They don't make omega-3. A lot of people think fish is a primary source of omega-3. It's not. It's a secondary source. And omega-3 is most abundant in the brain out of all the organs in the body. So the benefits associated with omega-3 have been well documented: improved sense of well-being, increased vigor and energy, improved reaction time, improved attention. It reduces depressive symptoms, enhanced cognitive function, better executive function, that means the frontal lobe is enhanced, improves your abstract thinking ability, even your ability to interpret proverbs, and it increases resistance to depression, and it can improve some of the aspects of ADHD, and it's been shown to actually increase your memory sections of your brain, and also improve brain-derived neurotrophic factor, which is kind of a brain fertilizer. In addition, it improves memory in those with middle-age-related cognitive decline. We put them on omega-3, and 3 months later, their memory significantly improves in memory tests. It lowers the risk of dementia. And among the elderly, omega-3 has been shown to improve your ability to take care of your daily duties, larger brain volume, improved learning and memory, and there's beneficial effects on neurodegenerative disorders such as Alzheimer's and Parkinson's, and even babies are benefited by omega-3. Mothers who are getting enough omega-3 in their diet, when they breastfeed their babies end up having a 5-point higher IQ than babies that were drinking formula without omega-3. Most of the formulas don't have any omega-3, and of course they don't allow them to be put in there because the primary sources of omega-3 that are used by Australians and Americans, etc., are fish sources, and fish has mercury, and mercury is very toxic to those infant brains, so it's better for them not to get omega-3 than to get mercury. But there is one formula that allows it, and it's not from fish. It's actually from where the fish get it from the plants of the waters. And that seaweed source of omega-3 can be very healthy for those babies. So the connection between eating fish and mercury levels is so strong that researchers seeking to determine mercury exposure among groups of people often look at only one dietary factor, fish consumption. And of course, fish also increase the risk of biomagnification. This is a rural lake up in California, north of San Francisco, called Clear Lake. There was that should not say omega-3 on it, by the way, that needs to be corrected. That should say DDT. It's a toxin. And the lake water has very little of it, but the phytoplankton have a little more, and then notice once you get to those very small fish that eat the phytoplankton, 40 to 300 parts per million of the toxin, and the carnivorous fish, 2,500 parts per million, and that's what people are fishing for. to eat. And so this is significant in regards to the toxic effects of fish. Fish is now known to be the most toxic food in our food supply. It didn't used to be that way, but with the pollution of the oceans, water, and of the streams, it's even gotten into the rural Aleutian, Alaska waters, etc., and even rural lakes and streams. Fish is not the healthy food it used to be 100 years ago. In fact, it's leading to more problems. By the way, what are some of those problems? As we mentioned, mercury. What will mercury do? Notice all of these symptoms. It's basically all of the opposite of what omega-3 does. And so we shouldn't be trying to eat a food that has both mercury and omega-3 because the studies are now showing the mercury is outweighing the benefits of that. We should actually choose foods that don't have any mercury. And so there's three different types of omega-3, but we can make the other two types if we get ALA, particularly if we're not having arachidonic acid in our diet, and that's another advantage of the plant-based diet. So ALA turns into EPA, which can turn into DHA, and the process requires B3, B6, magnesium, zinc, and vitamin C. Some of the very things we've been talking about can get more of those anti-inflammatory omega-3s into the system. Avocado has omega-3. Red bell pepper has it, kale has it, pecans have it, spinach have it, and even blueberries have it. But on that list, the top is actually avocado. And you can see green soybeans. Mature soybeans are not a good source of omega-3, but the green soybeans are. So edamame we serve a lot in our salads. Wheat germ has omega-3. If you're eating white bread, you're not getting any omega-3. Hemp seeds are a good source. English walnuts are even a better source. And then chia seeds and flaxseed are at the top. Flaxseed has more omega-3 than any fish you'll find on the market. We also want to avoid obesity. It's associated with low energy levels. After meal blood sugars over 140 are associated with fatigue, which the obesity stimulates. And getting on a weight loss program and losing more than 5 pounds can improve energy levels and mood significantly. And in choosing the best diet, there's been a lot of different studies done on a lot of those diets. But the only randomized controlled trial that has shown benefit in diets is a plant-based diet. So a lot of times people wonder, well, why don't you choose the paleo? Why don't you choose the keto? Why don't you choose this or that? And they sometimes think that I might be cherry picking. It's not cherry picking when there's only one cherry. And the best studies are randomized prospective controlled trials, and the only diet that's been shown in prospective randomized controlled trials to improve depression and anxiety in 2 weeks is a plant-based diet. The other advantage, no arachidonic acid, no cholesterol. The higher your cholesterol, the more problems with depression and anxiety you have. And that's been well documented. In fact, you're not going to respond well to medicines as well if you have too high a cholesterol. And you'll have better tryptophan and tyrosine uptake. One of the things that also helps, and we'll close with this, is intermittent fasting. Reduces damaging oxidative stress in the brain produces production of new brain cells, and enhances BDNF. This is the brain fertilizer. Excess calories reduce synaptic plasticity, making cells more vulnerable to free radical formation. And moderate caloric restriction can protect the brain by reducing oxidative damage. So ketogenesis is actually brought about most healthfully not by a ketosis diet, but by intermittent fasting. It enhances the body's defenses against oxidative and metabolic stress, initiates the remove or repair of damaged molecules, and that actually carries over into the non-fasting period the benefits of ketogenesis, even when you're on carbs. It improves glucose regulation, increases stress resistance, suppresses inflammation, and improves mental and physical performance. So how do you experience the benefits of ketosis without adversely affecting the brain? If you're on a low-carb diet, as mentioned, you're going to be having low tryptophan and tyrosine into the brain to make those neurotransmitters. But if you're intermittently fasting, you have ketosis, and then those carbs can help drive the tryptophan and tyrosine into the brain and help our neurotransmitter production significantly. Speaking of weight loss, we have a 4-step weight loss plan that has not failed in a single patient. Get rid of snacks. 1 out of 3 people are overweight, not because of what they're eating at mealtime, but because of what they're eating in between meals. Bigger snacks, bigger slacks. And we recommend not eating these snacks and drinking only water between meals. Eat a good breakfast, a moderate lunch, and if you're going to eliminate a meal, the meal to eliminate is your evening meal. Significant benefits over skipping breakfast. Eliminate or at least greatly reduce refined sugar and free fats or fatty foods in the diet while emphasizing foods high in fiber. And then moderate daily exercise for at least 60 minutes. You do all 4 of those, you will lose weight, and you will lose it steadily. If you need to gain weight, we have underweight people with anorexia that come to our program. Nature's most caloric-dense foods are nuts, and they're filled with good nutrients. Eating 2 to 3 meals per day with a half to a cup of nuts per meal will put weight on you. And so we recommend the healthiest nuts that will actually lower your cholesterol. Almonds, pecans, walnuts, hickory nuts, macadamia nuts will increase your HDL. There's a number of complications associated with skipping breakfast that have been well documented. You have higher rates of depression, decreased happiness, more loneliness, more sleep problems, and lower academic achievement. In fact, there's some nice studies showing a healthy breakfast will really help you in academics in college and more risky behaviors. The mental health advantages of eating breakfast are lower levels of depression and stress, better cognitive performance, better scholastic scores, and even improved creativity. This is why Erica has written this book, Brighten Up Breakfast, with all of the healthy foods to eat at breakfast to help your brain. I won't speak too much about folate or B12 deficiency, but that's also a major problem that can cause issues. I want to allow some time for questions, but I will close on this review article written by a European journal called Lancet Psychiatry. It was a review article on nutrition and mental health, and it closed with this: now is the time for the recognition of the importance of nutrition and nutrient supplementation in what field? Psychiatry. They went on to say nutritional medicine should now be considered as a mainstream element of psychiatric practice. In fact, we used to, when I started doing nutritional medicine, the evidence was there even 20 years ago for a lot of this. So we were starting to do nutritional medicine for psychiatry 20 plus years ago, and people called that alternative medicine back then. Alternative meant that it wasn't as scientific. But now, no one's calling nutritional medicine alternative medicine. As you can see, they're saying it should be mainstream. In fact, what they're saying is traditional care for psychiatry should be considered the alternative medicine. In other words, that's the one that's not as scientific, because studies are showing medications have their limitations, they have their side effects, and they have some long-term effects that are concerning. And let's get to the root issue, which nutrition can often get to the root issue and help us make these brain biochemicals in an abundant supply and help us avoid the need for those pharmaceuticals. So the real scientific medicine is now in the area of nutrition and lifestyle in treating depression and anxiety. And that's why I hope many of you take advantage of the upcoming program that Katie's putting on. Even if you don't have depression and anxiety, you'll be able to learn a lot more. In a 45-minute session, we're able to give you some information, but you'll learn a lot more coming to the depression and anxiety recovery program, and also have the nice health coaches that can help you through this. So I'll turn it over to Katie first, and then we'll have some questions after that. Katie.
Thank you, Dr. Nedley. This evening I've made some refreshments for afterwards that are related to what Dr. Nedley has been talking about. So I have made some of the foods that we showcase on the Depression and Anxiety Recovery Program. In fact, I've given them a new name. I said brain bomb burgers, which are simply loaded with omega-3, with things like flaxseed and walnuts and stuff like that. So I've specifically done that. I've also given you some fruits tonight. You're not going to say thank you to me because I've got a great big watermelon all cut up. So you may not be able to sleep, but you'll at least be able to test to see whether it works. And so we wanted to showcase that to you. Some people, when they hear this, I mean, I've heard this many times from Dr. Nedley because I've run his program over and over. How many of you really enjoyed that lecture? It's so, at first I thought you just about needed a master's degree to understand it, but then as I listened more and more to it, I thought, this is phenomenal, the way that we're made, how everything works together, and this thing carries the nutrient up to our brain. So I've tried to provide those. But some of you might feel like, hey, hang on a minute, it's all very well, but I'm stuck on my, almost stuck in those ruts of ways of eating that Dr. Nedley was talking about. Like the African ruts, we can get stuck in the same rut of what we're eating. And one other thing we do here at the Dundas Church is we run plant-based cooking classes. And so it's one thing to aspire to these foods. It's another thing to learn how to cook them and how to enjoy them and to taste them and think, right, okay, well, I can do this. So I'm going to leave some little flyers for those plant-based cooking classes out on the registration desk. And if you want to come, it's on Thursday evenings at 6:30 p.m, but it's not this Thursday because we've deferred to Dr. Nedley's talks. It's much more important at the moment. But it's not next week either because Chris is taking some lectures next week, but the one after we'll kick off again with our plant-based cooking classes. And that will be the means to helping you to be able to do the cooking and be able to enjoy them for yourself and introduce them as regulars in your diet. So thanks, Dr. Nedley, for that. Just a word on that, as I've got all that food out there for you. I've also, Dr. Nedley is very in the program, one of the, almost like the prescription medicine is omega-3. Isn't that right, Dr. Nedley? That's the prescription. And so right off the bat, on the first night, we introduce you to flaxseed and drinking it in a little bit of juice. And tonight, I'm going to make that facility available for you. I've got my friend Kerry out on a little station out there, and we've ground some flaxseed, we've got some juice, and I want you to dart over there and grab your little dose for the evening. The idea is you scull it quickly, and down it goes, and you'll see how simple it is. And like he said, you can introduce it into your foods in a lot of ways. The muffins that I've made, they are also loaded with flaxseed and walnuts and pumpkin seeds, some of them, and sesame seeds. And so you can put all these beautiful foods he's talked about, you can put them simply into your regular dietary habits. So I hope you enjoy that later. Dr. Nedley would like to answer some questions now, is that right? But that's something to look forward to as you go out the door. Don't forget to get your medicine for the night, and I'll pass it back over to Dr. Nedley.
Thank you, Katie.
Any questions? We can pass along the microphone here.
Good evening for everyone. I'd just like to ask about pumpkin seeds. How many grams need to eating every day, or maybe every second day, or what about this?
Yeah, so as far as measuring those out, you'll actually, when you go to the program, you'll get a whole graph of, how much you need of each of those nutrients. But in general, you know, a half cup of pumpkin seeds a day will do you very well. So you don't need any more than that, particularly when you're eating other healthy foods. And so that's why you can spread it out. That half cup can be spread out on your cereal in the morning and then a little bit more at lunchtime on your salad. Yes, question?
Hi, Dr. Nedley. Just interested in your, I found it very interesting about the methylation, because I have heard about methylation before and undermethylation. Can you go into a bit more detail about both again, please?
So let me see if I may have a graph of the methylation here. No, I thought it was right here. Methylation is adding a carbon and 3 hydrogens to a molecular structure. And it's sometimes called the 1-carbon add-on. And that is critically important to make the final step in a lot of different things, in our hormones, in our neurotransmitters. It's also very important for DNA transcription. RNA, it's used in a lot of different body functions. And the molecule that's used the most in methylation is a molecule called S-adenosylmethionine. S-adenosylmethionine donates that methyl group to produce the final step in these neurotransmitters and then becomes S-adenosylhomocysteine. So we'll actually be measuring all of those things when you come into our residential program so that we can see if you have what is necessary to be able to actually even make those nutrients. So I could give a whole lecture on methylation and have done so at our EQ Summit and go over all of those. But folate and B12, notice this, are also involved in methylation. The common mediator of the effects of B12 and folate deficiency is reduced SAMe. Correction of folate and B12 deficiencies may alleviate depressive symptoms and augment the response to antidepressant therapy because of the resultant increase in SAMe concentrations. So some of this may not be genetic, it may be lifestyle, it may be nutrition related. And so this is why some of our undermethylators that come into the program, or many of them, were using nutrition as a way to fix this defect. And it can completely fix it, where we will then measure the SAMe afterwards and it'll be completely normal. And, but they'll have to stay on the nutrients that got them there to adequate methylation. All right, another question.
Can you fix the B12 deficiency?
Oh yes, you can fix the B12 deficiency with B12 supplementation. If it's due to undermethylation, we'll give a type of B12 called methylcobalamin. And methylcobalamin, 1,000 micrograms a day, can fix it.
Just a question. Your residential therapy, is that done in America or?
Yeah, the residential program is done in America. You have to take that big flight over to San Francisco and either take a cheap train to Weimar University, or you can take another flight to Sacramento and we'll pick you up at the airport. But we've had many Aussies make that trip and it can be quite beneficial.
I'm blessed.
Great, yeah.
He's blessed.
Any other questions? Yes.
You haven't mentioned sprouts. They're very high in omega-3, magnesium and all that, correct?
Yes, so sprouted grains and other aspects, yes, they're very high in B vitamins in general, and they can be high, some of the sprouts can be high in omega-3 as well, depending on that. So that would be another way of getting it.
She's asking how long is your program?
How long is, okay, so the program that Katie's going to be running here is 8 weeks. That's the community mental health education program. So you're here for 2 hours, once a week for 8 weeks. And it's a good investment in time. It's very inexpensive, and it'll help provide the health coaching and things to do well. Our residential program is 10 days. So, and those are all, of course, you're immersed in that program. It's a residential program, so that's 10 days. So you have to put 10 days aside, maybe a day for traveling, because it takes about a day to get from Australia to here both ways. So you'd probably want to do 12 days to be able to do the residential program. Yes, question here.
Yeah. Thanks for your time. Just a quick question. I just want to get your take on the background and arguments for supplementation due to the fact that selenium was leached out of the soils. You would have heard this argument after World War II, and all the chemicals that were geared up for the war suddenly ended, and they had to get rid of the chemicals, so they sold them off to farmers across America, and I think Europe as well, and Australia, and they used them as cheap fertilizer. And I just wanted to get your take on, does selenium make that much of a difference, the deficiency and other things in the soil?
Yes, now selenium is one of those nutrients that does vary a lot from soil to soil and from grain to grain. And selenium is important. It's an antioxidant, particularly helps with the pyrrole disorder. So for instance, if you have a pyrrole disorder, we're going to want to make sure you're getting 200 micrograms of selenium per day. However, most of the other nutrients, one of the things that is kind of overstated by many well-meaning, zealous individuals is that our soil has been virtually depleted of magnesium, calcium, iron, all of these things. And if you don't have enough of those nutrients, you won't be able to actually get the greens to grow. You won't be able to get the grains to grow, etc. And so we need to have those nutrients in the soil in order to even produce good plant foods. And so the idea that you're eating plant foods that are just totally empty and depleted is not true. We have to have a certain element of that. Now, the one area where it tends to be most true is the one that you just mentioned, which is selenium, because it can be very, we can have selenium-rich grains and selenium-depleted grains because we can grow grains without selenium and do that, but not those other nutrients per se. We need to have those other nutrients in the soil. So it's important to recognize that you don't necessarily need to take supplements just because of the this idea that our soil is totally depleted.
How many Brazil nuts we can eat a day?
Brazil nuts. Yeah, Brazil nuts are a source of selenium, and 2 Brazil nuts will give you 200 micrograms of selenium. So if you're short in it, that's one way to go. We'll take just another question or two because we're here the whole week, and we can have more questions later. Yes?
GM foods.
Yes, what about genetically modified foods? One of the things that's important to recognize is our whole world works in the system of reproduction, and just like our children are not identical to us, neither is any grain identical to, quotes, the ancient grains, etc., because there's male and female and there's reproduction going on. So everything is genetically modified, so to speak. The thing about genetic modification is it's precisely modified through that genetic aspect. And that can be healthy, and often is, but if you have a corrupt company who's putting a rat gene in something, it could be questionable. And so it really depends on the ethics and morality of the company that's involved in it. There are those people that think genetic modification is bad across the board. It's not true. Genetic modification can actually be healthy. It can help resist certain diseases, etc., by doing that, and it's not going to alter the nutrient value of the substance or the plant food substantially. So we can still get those nutrients out of genetically modified foods, but just the cautionary note is it does leave it open for some unethical things to occur in the reproduction aspect. All right, I'll close with that, and I look forward to hearing even more questions in the nights to come. And of course, this weekend we'll end with a whole question and answer session so that we can have all of your questions answered.
Thank you so
Thank
much
you.
for your time, Dr. Nedley. Just very quickly as we close, as Katie already said, there's some light refreshments available, especially some of the things that he's already been talking about. As you heard Katie say, she's put that into the foods. So please feel free to spend some time afterwards, take some light refreshments, and just enjoy the time. Just one thing before you go, if you are interested in the depression and recovery program that we will be that we'll be hosting here, there is a little piece of paper on the desk where you came in and you signed in, and there's a box that says, "Send me an invitation to depression and anxiety recovery program." You can just fill that out. Please put your name on it, on the back, and the details so that we can send that to you, which is why we're actually asking you to register. And then you could just give it to somebody at the desk. So thank you for your time. We're just going to close our program with a short word of prayer. If you don't mind, let's pray. Father, thank you for this time. We ask that you please be with us and that you just help us. Thank you so much for caring about us, for providing ways to deal with these problems that we have. And we just ask for your blessing and for your healing in our lives. In Jesus' name we pray, amen. Thank you for joining us. We hope to see you tomorrow night. And as I said, please feel free to stop by and get some refreshments. Thank you.